Hi, my name is Charles Sweeney and I'll be performing the IM injection demo. First thing I'm going to do is I'm going to come to the medication cart and I'm going to disinfect it and wipe it down. Ensuring that it's nice and clean. I'm also going to sanitize my hands, ensuring my hands are clean as well. So we have Joe Milton today as a patient, and he's been quite agitated, and nursing staff and him have agreed that he'd like to take his PRN. So I'm going to come to the med cart. I'm going to look at the MAR. I'm going to find Joe Milton, and I'm going to look for his PRN medication. So his PRN medication is haloperidol, Haldol, 2.5 milligrams, IM injection, and that's Q 48 hours. And we're not to exceed 20 milligrams per day. Perfect. So I know what medication I need. So I'm going to go into the med cart and I'm going to find Joe Milton's box, and I'm going to pull out haloperidol Haldol. So I have haloperidol Haldol right here, and this is where I'm going to perform my first check. So I'm just going to ensure we have Joe Milton. Joe Milton on the vial. We have haloperidol Haldol, and we have 2.5 milligram IM injection. This vial is a 5 milligrams per 1 ml, so we'll have to do a medication calculation coming up. But we have the right medication for the right person. So that's our first check completed. I'll speak about the 10 rights right now. So again, we have the right person. We have Joe Milton on the medication. We have the right person and the right medication. So haloperidol Haldol. Awesome. We have the right dosage, so we know it's a 2.5 milligram IM injection. This, like I said, is a 5 milligram per 1 ml. So we know that we have a 2.5 milligram IM injection, therefore we need to have a 0.5 milliliter injection. That'll be our med calculation. So that would be the right dose. The right route is obviously an IM injection. IM, and it's liquid for IM injection. The right time and frequency, so I'll make sure I'll look at the MAR, and there's been no other PRNs given to Joe Milton today at all, so we know we can give him this PRN medication. Perfect. We're going to document after everything is done. Joe Milton has the right reason to give this, or right assessment, so that would mean he's feeling agitated, which would be the reason. Joe Milton has the right to refuse this medication as well. He has the right to education about this medication, so if Joe Milton had any questions, we'd be able to answer that, no problem. And he has the right to evaluation or understanding of the drug interactions that may be caused by this drug, or any interactions that have been caused by this drug. So those are our 10 rights. I'll prep my equipment now. So we have our medication, but I'm going to pull out my syringe and needle, which they came in the same package, which is convenient. So we have a 3mm syringe, and the needle is a 22 gauge, 1.5. Perfect. So I can use anywhere from a 22 to 25 gauge, and I'll be doing a deltoid IM injection on Joe Milton. He's an average build, so that'll be perfect for him. So we have our needle and our syringe. We have our alcohol swabs as well. So I'll just prep my needle and syringe for my next step. I'm going to pull it out, ensuring sterility. I'm going to pull out the syringe, and I'm going to lock it on to the needle. Perfect. So I'll just set that aside, ensure it's locked. Awesome. So before I do anything else, I'm just going to perform my second check. Okay? So I'm going to ensure that I have Joe Milton. Again, Joe Milton. Haloperidol Haldol, 2.5 milligrams IM injection, and this is a 5 milliliter per 1 ml. So again, 5 milliliters per 1 ml, and we need to give 2.5 milligrams, therefore we need a 0.5 ml. Perfect. Okay, and so now we can go ahead and we can prep the needle. So what I'm going to do is I'm going to draw some air. First of all, I'm going to use this alcohol swab, and I'm going to clean the top of my vial. Now I'm going to use my syringe, and I'm going to grab 0.5 milliliters of air. Set that down. The top of this is clean now. We'll set that aside. So I'm gonna take the top of my needle and I'm going to inject it into, there we go. So I'm injecting the 0.5 milliliters of air into the vial to equalize the pressure. I'm going to come up and I'm going to withdraw 0.5, ensuring air bubbles, which is pretty difficult with this water here. So there we are. So I'll take that out. And I'm going to scoop up the needle tip. There we go. So if you want to get a better view of this, as you can see, I have 0.5. If that's easier, 0.5. Awesome. Great. So the air bubbles are pretty much gone out of this as well. So that would be our needle. So I'm going to perform my third check right now. So we know we have Joe Milton. Again, Joe Milton, haloperidol, haldol, haloperidol, haldol. And we do have 2.5 milligrams or 0.5 milliliters in the syringe, which is the right dosage. Awesome. So we have everything we need. I can put this away now because our third check's been completed, so I'll lock it away. Awesome. So I'm going to gather my supplies and I'm going to go see Joe Milton in his room. So I'm going to grab my syringe, I'm going to grab some more alcohol swabs and possibly a Band-Aid as well and a cotton swab. I'll head over to Mr. Milton's room. I'll knock on, before I go in actually, I'm going to hand sanitizer again, making sure my hands are nice and clean. And at this point I'm going to put some gloves on. So I'll put some gloves on and I'm going to go into Joe Milton's room and I'm going to ask him for his name and his date of birth, his full name. He'll tell me his name and then I'm going to check his bracelet and I'm going to confirm that again with MR. Just to ensure he is who he says he is, so we're giving the right medication to the right person. So everything's great. Joe Milton has no questions about the medication and Joe Milton is willing to take the medication. So we have no issues. I'm going to ask him which arm does he prefer to use and taking into account other medical conditions, and he doesn't have any issues with any arm. So I'm going to inject him into his right deltoid. So I'll approach Mr. Milton and I'll say hi. I'm going to do it in your right arm, and to landmark for this, what we're going to do, unfortunately we don't have a mannequin, so for testing purposes I'll just show you on myself. So you're going to find the acromion process on the shoulder here, and I'm going to use 3 fingers down, or 1.1 to 2 inches, and that's where we'll use our injection spot. Perfect. So I'll use this chair as the mannequin. So I'm going to find Mr. Milton's acromion process, 3 fingers down, and I'll make a small V here just to, and I'll use my alcohol swab and I'll clean the area. I'll get Mr. Milton to hold that if he's capable, and Mr. Milton is capable, so he'll hold that while I get my needle ready. So I'll take the cap off my needle for testing purposes. I'm just going to leave that on, and I'll go in, I'll Z-track, take the alcohol swab away, and just ask Joe Milton to relax, and I'll count down from 3, 2, 1, and I'll inject the needle at a 90-degree angle. Once the needle is inserted into Mr. Milton's delt, I'll go ahead and I'll aspirate the needle. At this point we're looking for flashback of blood. So if we see flashback of blood, we're going to have to redo this medication. We'll take the needle out and redo this whole process. But if not, which is the case in today, we can go ahead and inject the needle. So inject the drug, sorry. So I'll inject the haldol haloperidol into Mr. Milton's deltoid over a period of about 10 seconds. I'm going to look at Mr. Milton's face, ask him if he's doing okay, and seeing if he's in any sort of pain. No pain, and the needle's injected. I'm going to remove the needle at a 90-degree angle, the same angle I came in at, And I'm going to dispense the needle into the sharps container right away. I'm gonna get Mr. Mountain a cotton swab or another alcohol swab away any blood that's there, put a band-aid over him. I'm gonna ask him if he's doing okay, if he has any concerns. He's okay, and I'm gonna come back in 15 minutes to check on him just in case. So I'm going to leave the room, taking all my supplies. I'm going to ditch my gloves. I'm going to perform some hand sanitizer again. Ensuring my hands are nice and clean. And then I'm going to come back to the med cart. So we come to the med cart and we're going to look at Joe Milton. We're going to go down to his PRN section and we're going to sign off on the time of day that we gave him his PRN medication, ensuring we have proper documentation. And that about wraps up. Our IM injection demo. Thank you.